there's a case presentation for alignment basis. 65-year-old female with a lot of deformity, walking with stick, BMI 25, ASA grade 2, good heart function. And that's her, the initial photograph showing a windswept deformity. Now, what sort of alignment do you think in a windswept deformity? So
I think everybody has already said what they do, so go ahead.
So there's a pre-op X-ray showing valgus on the right side and the varus on the left side with a bone loss. And these are the X-rays with stress views.
So you want to discuss both sides or any particular side that you want to panel?
Both. So you can.
So start from Amar. Would you do this bilateral? And what is your, which one will you do first? And what is it that you're going to do?
I would generally not do them bilaterally, but I could. Her deformities are severe enough. But yeah, I would just do mechanical alignment and balance the valgus knee. And once you restore the bone, it'll, PS knee is on both sides.
Right, and the valgus knee, you don't foresee much of a problem here, right? The amount of deformity and the medial collateral appears intact.
In my experience, the medial collateral is always intact in the valgus knee. People always talk about it being incompetent. It's not incompetent, it's just, it's got to be tensioned, and you got to release the lateral side to tension it.
Okay, Ashok, what do you?
Given the ASA and EF being normal, I would do a one-stage bilateral. I would do a medial congruent knee, aiming for a HK 178.
Thorsten?
Yeah, very similar. I have a very low threshold to do it bilaterally. On the valgus knee, I mean, it's depending, of course, on the medial collateral ligament. If it is sterile, no problem, go for a mechanical alignment. And if it is completely instabile, I agree with Amar, it's quite rare, then I would go for a more constrained knee.
So I will go for bilateral. The left side probably will get a stem on the tibial side because there seems to be a bone loss, and I don't want to cut too much bone to cover that bone loss. So for me, anything more than 50% of a single condyle, if the bone is lost, that patient gets a stem. So most probably there will be a stem on the valgus, the bone loss side, and the other side will be a conventional mechanical aligned PS knee.
All right, I think you show what you've done because...
Yeah, so which one to follow? So I did all robotics all the time. So this was a right knee. We started with left knee with a 30 degree of varus and 1.15 millimeter degrees of extension. We can see a very tight medial side and a large lateral opening on lateral side. I want to ask you, the kinematic guys, how you balance this large lateral gap in extension with a valgus of the femur? Because if you put a valgus on the femur, it's going to open up furthermore. So there we have used 1 degree of varus on the tibia, 10 degrees because of the large bone loss, and 9 degrees of external rotation compared to the posterior condylar axis. And that's what gave me a reasonable good balance on this side. And
a 1 degree of varus on the femur.
Yeah, 1 degree varus on the femur.
Yeah, so that is exactly what I was saying, that I tried to follow the CPAC as to do, and then it actually doesn't work in giving you less, but this does.
Yeah, so overall, and that's the final alignment here on the right to the left side with 3 degrees of varus. So I don't chase the zero, we just chase the right alignment and the good balance. Here, right side, 17 degrees of valgus, 6 degrees of flexion, and here you can see a large tightness on the medial side, opening on the medial opening 13 degrees and 30 millimeters, 17 degrees here. Of course, here instead of 3 degrees, we went on 2 degrees of internal rotation. Because of the large medial opening, we have to close it. These are the indications where you have to do internal rotation compared to say condylar axis on a robotic knee, where you can do still internal rotation and you can get a good balance of the joint. That's the final outcome, and that's the final X-ray of both knees post-op. I'll show you the other X-rays and the function, and that's a particular tracking instead of having instead of internal rotation of the femur. And that's supposed to have X-ray 1 month. And any comments on that?
Well, that looks very good. I will ask the panel. I'm a little bit worried about your screw holes on the right side in the just distal to the tibial base.
Okay, that's a pin placement, yeah.
I put the pins within the stem.
One goes just close to tibial tubercle, other goes
Yeah, they
down.
never
Okay.
fracture, right?
I think, yes?
I said they never fracture.
Yeah, well, Vaibhav, you wanted to say something?
So I'm not brave enough to put 9 degrees on femur. Okay, I believe, as I said, that TKR should be 3-step procedure. Basic exposure / releases, as Dr. Rajgopal said, juggling your cuts within your boundaries, and then fine tuning with the releases that remain.
What did you put 9 degrees?
9 degrees of external rotation of a condylar posterior condylar axis.
Rotation.
Rotation 9 degrees.
And that's what the Ranawat technique is. Ranawat block technique gives parallel to the tibia. So it's a
It's not the
combination of
varus to
Ranawat
valgus,
technique.
it's the rotation, and I've gone up to 11 sometimes when the
13 as
condyles
well.
are deficient.
Yes.
No,
But
so
I'm
in
so-
that case, I mean, when you feel that it's deficient, you should use probably, I mean, because that's erroneous. Either you use a white side or parallel to tibial cut. So, I mean, so that's 9-degree kind of
No,
is a red flag for
this
me.
is parallel tibial cut.
So if it's parallel to tibial cut, it's like a normal rotation. Okay.
Yeah, so I'm surprised how come with 9 degree of
I
external
said posterior-
rotation,
I
you don't
mentioned-
have notching.
posterior condylar axis.
Rajesh,
Okay, yes.
can I make a point? When
Yes.
you say 9 degrees and parallel to the tibial cut, the average common stupid mind like mine would say that your tibial cut is wrong.
No, but
Why
this
else
is,
would you
he's
get
talking
9
about the valgus knee where there was a lateral condyle deficiency, where the, you know, if you go by the.
Yeah, but regardless, you're manifesting that from your tibial cut, right? So where do you get the 9 degrees?
No, so to tibial cut, he has put it in parallel, right?
One-
Is that right?
one degree.
It was a varus knee.
1 degree varus. 1 degree varus.
No,
Okay,
no.
the X-rays
We're
look
talking
fine.
about the rotation.
The X-rays look fine, the rotation's fine. Like,
Yes.
Okay, good job.
Exactly.
Registration.
And that's a long axis view to show it is just close to the mechanical.
And I think the Unmesh has tremendous experience. He's done more than 1,500 cases. I think.
2,500 cases.
2,500 cases with the robo. So that's tremendous
Thank you.
result. Thank you, Unmesh.
Thank you.